Hi and welcome to Heal My Hemorrhoids. In this video you will learn if hemorrhoids are common in the third trimester, what tips and tricks to use when treating hemorrhoids. Remember to hit the like button and subscribe for more videos. Nobody likes to discuss them, but hemorrhoids are a fact of life for several people, especially during pregnancy. Hemorrhoids are just veins outside of your anus that have become big and swollen. For the majority of pregnant women, hemorrhoids are most common in the third trimester, starting around week 28. The increase in blood flow and the growing baby causes the hemorrhoids to develop, and the majority of women who experience constipation during pregnancy are likely to get hemorrhoids. Also called piles, they can seem like varicose veins when outside your body. Hemorrhoids are developing frequently during pregnancy, particularly in the third trimester hemorrhoids, and during and shortly after delivery. You might have hemorrhoids only during the pregnancy period, or you might have them at other times of your life as well. The causes of your problem might be unique to pregnancy. You can often treat or prevent hemorrhoids with some remedies and lifestyle adjustments. Are hemorrhoids common during pregnancy? Though hemorrhoids can appear at any stage, most commons to get in them in the pregnancy hemorrhoids third trimester, starting around week 28. The increased flow of blood to the pelvic, as well as force from the enlarging uterus and growing baby, can cause the veins that run through the anus area to swell. Hemorrhoids can also outcome from constipation. But thanks to pregnancy hormones, bowels slow down during this critical period. When the stool is solid, the additional straining to remove it can put serious pressure on veins in your rectal, causing them to become inflamed. On top of that, extreme progesterone ratio cause the veins wall to relax and let them swell very easily, and that is the case of pain. If you had hemorrhoid issues before the pregnancy period starts, you are more likely to have them during and pregnancy period. Hemorrhoids might also develop postpartum as an outcome of extreme pushing and during labor. How do you get rid of hemorrhoids in your third trimester? There are several home-based remedies as well as lifestyle modifications you can try to decrease hemorrhoids. It is the best idea not to ignore them, since untreated hemorrhoids might get worse with time and might cause serious complications such as increased pain, or in rare cause anemia from bleeding. You might also need to be in touch with your doctor to diagnose and treat your problem. Since hemorrhoids are not the single cause of bleeding near your anus, it is always a fine idea to speak to your doctor if you notice something new. When should you get medical treatment for hemorrhoids? You might want to see a doctor before treating hemorrhoids at home. That'll make sure you get a perfect diagnosis and understand the proper treatment options available for the problem. During pregnancy, always speak to your doctor before taking any medication, including those you can apply to your skin. That'll make sure treatments don't pose a risk to your baby. Your doctor might be capable to recommend a safe laxative or a suppository to relieve constipation. And witch hazel might also be a treatment for hemorrhoids, but always talk to your doctor about this first. Some prescriptions for an oral cure, like Hydramine trusted source, are available for treating this problem, but they might be not safe for pregnancy and breastfeeding. Tropical treatments available over the counter or by prescription might help hemorrhoids, but they might not be safe for pregnancy. Ensure to discuss them with your doctor. These topical medications might include pain-relieving and anti-inflammatory ingredients. Medical hemorrhoids treatments in the third trimester, sclerotherapy, a chemical-based solution is injected directly into the hemorrhoid. This can cause it to shrink and form scar tissue. It is possible for hemorrhoids to return after this cure. Rubber band ligation. During banding, a small-size rubber band is placed around the hemorrhoid base. The band prevents the blood flow into hemorrhoid, and eventually, the hemorrhoids will fall off. This normally takes 10 to 15 days. Scar tissues are formed during this procedure that helps to prevent hemorrhoids from recurring in a similar location. Stapled hemorrhoidopexy. The hemorrhoidal tissue is located back in the anus and held in place using surgical staples. Hemorrhoidectomy. This is a surgical method to remove hemorrhoids. It is associated with several risks, including general anesthesia, risk of harm to the muscles of the anus and further pain, and long recovery time. As an outcome, this process is only recommended for severe hemorrhoids or when there are serious complications, such as several hemorrhoids or hemorrhoids that prolapsed. Home remedies. There are several things you can do at home to prevent hemorrhoids. Use flushable and gentle wipes when you using the toilet. Use pads or wipes that contain witch hazel. Take Epsom salt bath in warm water that is not too warm. Hold a cold pack on the area for 5 to 10 minutes for a couple of days. Drink too much water and consume foods high in fibers to help you keep stools soft. Walk around frequently and be assured not to sit for too long to avoid additional pressure on your anus. Perform Kegel workout to strengthen body muscles. Lie on your side rather than sitting to decrease pressure on your anus. Avoid straining while having a bowel motion or sitting on the toilet for long times a day. Your doctor might suggest packing the site of the hemorrhoid area with absorbent bandages to avoid extreme bleeding. Try these remedies to treat the hemorrhoids problem. If these are not efficient, then call a doctor as your best bet. When should you go to the doctor for hemorrhoids? When pregnant. Consult your health provider if preventive methods and home remedies do not help, or if you've serious pain or rectal bleeding. In some cases, you might need professional help to shrink your hemorrhoids. Also, forever check with your health provider before taking any supplement for hemorrhoid while you are pregnant. There are a lot of hemorrhoid relief supplements available. Remember that most of these supplements should be used for no more than 7 to 10 days to avoid such side effects as skin thinning or irritation. For several women, hemorrhoid symptoms resolve after the child is born. If they persist, a surgical process might be recommended. Thanks for watching. Don't forget to hit the like button and subscribe for more videos. Hope the video was helpful.